Hi, I am Dr. D.V.L. Narayana, surgical gastroenterologist and laparoscopic surgeon at the Apollo Spectra Hospitals, Kondapur, Hyderabad. I would like to introduce to you various diseases of different organs of the gastrointestinal tract. Common diseases of the upper gastrointestinal tract, which consists of esophagus and the stomach, are the acid related disorders. These acid related disorders are, we can say, three types. Number one is ulceration, for which the patient might get pain and burning sensation. Number two, gastroesophageal reflux disease, wherein this acid refluxes into the esophagus, causes the burning of the esophagus, which will be like a heart burn. The heart burn is very important because many times it is confused with the heart disease. Okay, but how it is diagnosed, first heart disease is more important than the esophageal disease. That's why we always first investigate for the heart disease. When it is ruled out, then the gastrointestinal esophageal reflux is suspected and endoscopy done, it is diagnosed and treated. Number three is cancers related to these two organs, that is esophagus and the stomach, for which surgical management is usually needed. Other modalities of management of the cancer are very less useful in these organs. Other common organs which are involved, the most common gastrointestinal problem, especially the surgical problem, is appendicitis, which every one of you should be aware of. Appendicitis is a common disease. It is the most common surgical emergency all over the world in many age groups, especially in young individuals, for which immediate surgery is offered, no medical treatment is offered. Other common disease in our society is gallstones. Gallstone incidence is increasing because of our changed food habits and also obesity. Gallstones are more common in women because of their hormonal milieu when compared to the men. These gallstones also are managed surgically. Many people, what we come across in day-to-day practice is people, they try to take several types of remedies including Ayurvedic and also homeopathy and home remedies with the hope that gallstones will dissolve and patient will become alright. Usually it is not done so, and usually medical treatment is not recommended. It is surgically it is managed. That too nowadays in a very simple way, laparoscopically. Even in laparoscopy we are going with an advanced laparoscopy techniques wherein the patient is operated in the morning and discharged in the evening. So because it has become so simple, never these are managed medically, always they are managed surgically. As far as other problems are concerned, next is the colorectal problems. Colorectal problems, when you say, you usually say it's a constipation. Even though pain abdomen is a problem of any surgical or any organ of the abdomen, the colorectal problems are mainly bleeding and constipation. So whenever patient comes with the constipation, usually the medical treatment is given for constipation. For bleeding, generally colonoscopy or proctoscopy is done, it is diagnosed, and majority of these things also require surgical management. Yet especially the people who are of above 45 to 50 years age groups, cancers are one of the common problems of bleeding. That's why one has to be very careful, and even now in Western countries there is a screening program available for this. Even in India, because of the increased incidence day by day, probably we may also come out with a screening program wherein regular colonoscopy is done after 45 to 50 years. Other organs involved are mainly the pancreas and liver. Liver problems, majority of obviously medical problems, but some liver problems, especially the liver tumors and liver cancers, require surgery, which will be actually very highly skilled surgery with a good setup. The Apollo Hospital, Kondapur, has got all the facilities of including liver surgery and pancreatic surgery, and some of these surgeries even we are doing laparoscopically. As far as the pancreatic surgery is concerned, pancreatic surgery, especially pancreatic stones, very common in Indian patients, especially South Indian patients. The Kerala has got the highest incidence. Next highest incidence in India, and also I can say in the world, is our state, Telangana and Andhra Pradesh. That's why we come across with a very common problem with these stones. Majority of these stones also require, especially when they have got a lot of stones and also lot of derangements and anatomical variations in the pancreas, they may require surgery, and surgery is very effective even in these pancreatic stones too, apart from the pancreatic cancers. So as a whole, if you take all these organs or whatever diseases are there, initially managed medically, and whenever there are tumors, surgically. Even if the medical problems also, whenever they are very severe, surgical management is needed in all of these problems. As far as the facilities in our institute are concerned, we have got a facility to treat each and every problem of this, both medical and surgical. Thank you.